Good morning, good evening, good night, doctors, nurses, and pharmacists. Can you hear me?
Yes, sir. Yes, sir.
Okay,
Yes,
thank
sir.
you. Thank you. Okay, so sorry for delay. Can you see my screen?
Yes, sir.
Yes, sir.
Okay, thank you. Okay, so most of you have written this letter today. Okay, so here just let us give an overview. So mostly, most of the things are related to medicine, but overall, as you know, we only take combined class. So that is why I decided to give it to nurses also, so that you people can practice. Okay. So please mute. If you need to talk with me, you can talk. Otherwise, please. Okay. So if, but overall, it is good practice how to write medical history, how to write a letter, how to organize information, how to select the case notes and these things. So this is important. Okay. No, anybody can talk with me?
Yes, sir.
Yes, sir.
Okay. Okay. So what you will do if you get these case notes in the real exam, what you will do first? What we will do?
Yeah, we would go to the management plan at the bottom.
Okay, just first we read this. Your doctor nurse at this clinic, read the case notes and complete the task. Okay, just quickly. Then we will go to the task. In the writing task, using the information in the case notes, write a letter to Dr. Che for further investigation and treatment plan. Okay, so this is the name of the reader of this letter, and these address and these things, hospital name. Just give me 2 minutes, please.
God.
What is this? What is this? What is this? Okay. So, Miss Rama Rose, please turn off your cam. Okay. So we have done. Okay. So what you can see here is what we want from the reader. Okay. Now we need to go to the plan. Refer to pediatric specialist as soon as possible for further investigation and treatment. Still it is the same. Still we don't know the diagnosis. Where we can see the diagnosis?
नहीं पासपोर्ट बिल्कुल सही है पहले भी ऐसे ही था एक कहाँ है ये देखो वो नहीं आता वो क्यों नहीं तो आता है तो ये ओपन हो जाती है फिर क्या बचता है ओपन हो जाती है ये बस सर्च करने
Okay. So please mute.
उसके बाद कुछ आता है
Diagnosis is written just above the plan.
Okay, so what is the diagnosis here? So please
Pyloric
always
stenosis.
remember, please always remember, this writing task is very important. This writing task is very important. This plan and this assessment is very important. Okay, then you need to go to from the start. Okay. So here is the written pyloric stenosis. This is the main diagnosis, but this is not medical exam. What is written in assessment? This is your diagnosis, and it is moderate dehydration and pyloric stenosis. So we have two diagnoses here. So what we want from the reader? Can anybody tell me what we want from the reader?
Diagnose the problem.
How they will diagnose?
They will do all the investigations.
So what exactly we want from the reader? What exactly?
Ultrasound.
Ultrasound of abdomen.
That is also a little bit detail. Jay Master asking the main thing is further investigations and treatment. This is what we want from the reader. Okay. So what is the main issue of the patient?
Vomiting.
Pyloric
Projectile vomiting.
stenosis.
Pyloric stenosis plus moderate
Moderate
dehydration.
hydration.
And what we want from the reader is investigations and treatment.
Treatment plan.
Okay. So what is our purpose? Any nurse? Any nurse
Yes, sir.
can talk? Yeah. What would be the purpose of this letter?
Purpose urgent. Urgent referral.
Urgent referral for investigation and treatment
Just
plan.
tell me the exact purpose. What you will write?
refer the patient.
Yeah, I'll write that. I'm
Let us
writing to
take
Mr.
somebody. Yeah, let us take somebody's here. Okay. So here any nurse. Okay. Miss Marilyn. She will not be. Miss Marilyn is there. Miss Marilyn. Miss Bagia. I'm writing to refer master. Really, this is old style to use master for babies. Master, no, just write Braxton because for babies we use first name. Please read the purpose and write the mistakes in the chat. I'm just going to see a patient. I'm just coming in 2 minutes. Read the purpose and write the mistakes in the, just see if there is any mention of urgency or not, urgent or not. And okay, so is everything mentioned here, some mistake is here also. So please write the mistakes in the chat. I'm coming back. Okay. Was diagnosed is wrong. This is suggestive diagnosis. Okay, this is not suggestive diagnosis. If it is suggestive diagnosis, means this, there would be one question mark here. Okay, so this is not suggestive. You can write as is diagnosed, but was diagnosed is wrong, not good. I will not say wrong, but is not good. Okay, here we need hyphens. Weeks should be without s. Okay, the master we done it, who has been diagnosed with, okay, who has been diagnosed with parostenosis with moderate dehydration, okay, or who has also, okay, who has parostenosis with moderate dehydration. Your further investigation treatment would be highly appreciated. Almost okay. Just we need to mention urgent, and it can be here. I'm writing to urgently refer, or your urgent investigations, and here we need hyphens, and here has been diagnosed would look better. Okay. So this is what we need to write in the purpose. The two things: what is wrong with the patient, what we want from the reader for patient. Okay, can you hear me?
Yes,
Yes,
sir.
sir.
Okay, good. Okay, then what I will do is, in the real exam, in the 5 minutes, you will just read. Okay, is male. After you read this, okay, after you read plan, okay, task and assessment, you just don't need to write purpose. Okay, just keep in mind what this is: as soon as possible. It means urgent letter. Okay, as is, it means as soon as possible. ASAP, as soon as possible, it means urgent letter. Okay, so people on Facebook are also commenting, so I am seeing your comments also. Amina, Arif, Nizar, Rafael, Nareen, Rabia, Maha. Okay, so if any of you, those who are on Facebook, if you are still not in my WhatsApp groups, you can join and can directly join me with Zoom, on Zoom. Okay, there are almost 80 people with me on Zoom, and you are also almost 20. So in more, okay, so then you will read quickly what is written in each visit. Okay, so here is name of the patient, gender is male, date of birth is written here, age is written here. Why I'm writing both of these things? because some of you, okay, may write both of these things. If both are given, just write one of them, not both of them. Okay. Okay, so now then we have mode of birth, vaginal delivery, use of forceps, episiotomy, no. A gestational age, birth weight, Apgar score, place of birth. Okay, mother, this is not real hospital. These are just my inventions. Okay, we cannot use real names. Okay, so this is mother Anna Malkova. So these are details about mother. This is father. These are father details, grandfather details, grandmother details. Okay, then what we need to see before we read the details in each visit, what we need to see?
The dates.
What we need to write? Dates. Very
Dates.
good. Excellent. Okay. Excellent. Okay. So then we need to see the dates. So this is 9th of August when I have written these case notes. 9th. Yeah. No, this was the first visit. So no, this is 9th. Okay. So this is 9th of August, the first visit, and this is the second visit when I have written these case notes. This was the exact same date. Okay, 6th of September. Okay. So then we have assessment, we have plan, writing task. So we have two visits. How many visits we have?
Two visits
Two
total.
visits.
Two visits.
Okay, just quickly let us see what is written within the. Okay, mother is waitress, cooks herself, diabetes, gout. Father, NHS manager, 36 years, hobby tourism, hypertension, captopril. Father died of lung cancer, grandmother died of breast cancer. On this date, mother brings to GP clinic with vomiting, starts 5 days ago, 30 to 40 minutes, no blood, non-meals 3 to 4 times a day, no fever, cough, runny nose, diarrhea, making less wet nappies, feeling hungry even after drinking milk. Okay, this is the examination. This is the assessment. Cow milk allergy was suspected. Okay, switch to elemental formula. Keep diarrhea of symptoms. On this date, no improvement. Okay, still vomiting. So this is say flying out of his mouth. No bilious. Okay, so no fever, no runny nose, no diarrhea. This is examination, and this is the assessment, and this is the plan. So can anybody tell me this visit of 9th of August 2022, is this relevant or irrelevant? No audio. I think there should be problem on your side, Dr. Dinesh. Please check on your side. It is okay from my side. Yes, please.
I think it's relevant.
Relevant.
Is irrelevant or relevant?
It's relevant.
It's relevant.
Irrelevant.
Relevant.
Relevant. Why?
Relevant.
Why?
Relevant.
Why?
Because on that day, mother.
Okay, so
Because that
we
was
have
when you first
purpose.
reported the symptom.
We have purpose. Then we can say birth history plus family history. Then we have initial visit. Then we have today's visit. Then we have conclusion. Okay. Okay. So reflecting same issue, relevant. Okay. How to initiate symptoms. Okay, good. People are commenting on Facebook also. So how many things we have, how many things we have in this letter? How many paragraphs we can write? Number one would be purpose. Last one would be the conclusion. Then we have birth history, family history. We have initial visit. We have today's visit. So how we will organize? How we will organize this letter? How we will organize this letter? Any nurse? I take more nurses because nurses are weak, okay? So how we will organize this letter, please, quickly.
Sir, I think it's urgent letter. So
Uh-huh.
after purpose, we have to write the today's visit, in my opinion.
Uh-huh. Is this obligatory to write in every urgent letter today's visit after purpose?
I'm not sure, but I think so.
Yes.
It is not obligatory, okay? It's not mandatory. It depends
Okay.
upon the situation.
Okay.
In this case, after purpose, we should write today's visit, okay? Okay. But even as this letter, in this letter, okay, I will accept if you write initial visit, then today's visit also, because it becomes a little bit difficult to understand today's visit without initial visit. Okay, I will accept both of these ways, but social history, family history, personal history, you should keep at before conclusion. But let us go with one only way, that after purpose we will write today's visit, then initial visit, then birth history, family history, and then conclusion. Okay. So out of these, mode of birth, gestational age, use of forceps, Apgar score, place of birth, mother, Malkova, age, restaurant, cooks, diabetes, gout, father, NHS manager, tourism, hypertension, lung cancer, grandmother, okay, diagnosed with cancer, 2021. Okay, any nurse who has not participated so far? Amna.
Yes, sir.
Yes, sir. I am a doctor.
Okay, Dr. Amna. So, Dr. Amna, for
Yes, sir.
doctors it is easy. For doctors it is easy. Okay, let me take one nurse. Okay, okay. Any nurse?
Okay, sir. No problem.
Any nurse? Any nurse?
Yes, sir.
Okay. So, what do you think about these things? About the birth? Mode of birth is important to mention or not?
Sir, I don't
Is
think it's important.
a vagina delivery? No.
No, sir.
Yes.
Use of forceps episiotomy.
No.
No, sir.
Yes, sir. It's necessary.
Gestational age.
No.
Yes.
No, sir.
Birth weight.
Yes.
Yes.
No, sir.
No. Okay, good. Apgar score.
No need.
No.
Okay. Mother's history. What is important in mother's history that we should mention?
Diabetes letter.
Diabetes.
Diabetes. Very good. Anything else?
Yes, and taking
Please,
allopurinol.
who is iPhone, Dilani, please. Okay, let me mute. Okay. Okay. So in mother's history, what is important? Her age, her name, waitress, cooks herself, diabetes, gout. What is important?
Diabetes
Diabetes
and gout.
mellitus and
Diabetes
medication.
mellitus.
And gout and her age. Almost in mothers, there is nothing important. Okay. It has to do nothing with pyloric stenosis, these things. Okay. Mother history is
Yes.
almost not important. Okay? Nothing is important. If you want to
Yes.
mention anything, it is your choice. I will not consider as too wrong, but nothing is important. Okay. Father, hypertension since
No,
2010
no,
still,
nothing is important.
Nothing
still
important.
No.
takes captopril once daily. This is the age. NHS manager.
Not
No
important.
need.
Nothing.
What about grandfather died of lung cancer?
No, not
Nothing.
at all.
No.
Grandmother
Irrelevant.
died
No,
of breast cancer.
No relevant.
Irrelevant.
not really.
Now, if I change the case is suspected lung cancer in an adult, not a baby, then grandfather's history is important.
Grandfather.
Yes,
Yes,
important.
then is
Yes.
relevant.
You can see how the
Yes.
things change
Yes.
according to whom you are writing.
Mm.
Okay. So can anybody tell me when I have written these case notes, these are written by myself, okay? This is not copy and paste from anybody else, written by myself, okay? Okay, so why I have included this mother's history, diabetes, gout, this and that, father, a lot of history, grandfather, grandmother, why? Can anybody tell me
Distract.
why?
To check how
Just to
to
check,
organize
just to
that
check. If you include all of these things, believe me, you will not, if you are nurse, you will not get C+. If you are doctor, you will not get B. This is clear rule. Even I don't need to mark your rest of letter, okay? This is how you need to decide according to what is important. And here, this one is very important. Mode of birth is very important, okay? Gestation and age is very important. Birth weight is very important. These three things are very important. Why?
Oh,
Yeah, this is just 7-week baby, and
7
when
week.
in pediatric patients, this is we also call it as pediatric history. So pediatric history is very important, okay? Very important. So now we have three things instead of here family history that we don't need. So we have birth history, you can also call as pediatric history. Please mute. Okay. So I'm going to remove, okay? This person. Just silent, okay, good. Okay, removed, okay, that is good. So make noise and get removed because this is a lot of noise for the other people, okay? So we have three things, for, okay, birth history, initial visit, today's visit, okay? So then today's visit will be here, then we will have initial visit and then we will have birth history, okay? This is how you will write this, organize this letter. So you need to decide these things before you start writing letter. What is important, what is relevant, what is irrelevant, okay? How you will organize letter, which type of letter this is. Can anybody tell me why I have written this question mark with cow milk allergy on the first visit?
Suspected.
Suspected.
Suspected, very good, suggestive, suspected, okay? Okay, I don't only play because in the real exam, the examiner will play with you also. Somebody is saying I am playing with you. Okay, that is good joke. But in the real exam, the things are like this, okay? You have to decide quickly. You have to organize, okay? So now what we have done is, so we know the type of letter, we know to whom we are writing, to a pediatric specialist. We know it is urgent letter. We know what we want from the reader, what is the diagnosis. Okay, so these things will be written in the greeting. I used to write the greeting very quickly in my real exam before I started organizing. Okay, then we have the organization, how we will organize the letter. We have, please, who is making these lines on my screen, please. Don't draw lines on my screen, please. Okay, okay, then we have 2 visits and we have skipped this irrelevant information, okay? Now, purpose you have already told me. This is the purpose. Okay, let us improve it. Okay, I'm writing to refer. Okay, as this is a child, we will only use first name, not the second name. Braxton. Okay, as an adult, Mr. Jamison. For child, we use only first name. Okay, so I will use Braxton. Okay, then here 7 week old. Okay, you can write baby, you can write infant, whatever it is written there. Okay, who has been diagnosed with, okay, or who has, I would prefer whose signs and symptoms are consistent with, okay, parastenosis with a moderate dehydration. Okay, this is okay. You are further. So I'm writing to urgently refer. Okay, any problem in no in the purpose? Any problem in the purpose?
No, sir.
I think is okay. So one secret, I'm going to tell you how you will write the conclusion. So it is very easy. Purpose will be clearly written. Okay. Now I'm writing the conclusion. Okay. Just I'm telling how it would be easy. In light of the above, you can write given the above information in light of the above. There are many other ways. Okay. I usually use this in light of the above.
Sir,
I
can
would,
we use in view of the above?
yes, in view of the above is also okay. Even without it is also okay. I would be grateful if you could. You can see I'm using could. This is polite language. If you could further assess and okay, investigate. We can write a further investigate. Okay, which form of verb which form of word I'm using? Is verb. Okay, is verb, and here is noun. Here is verb. Okay. If you go further investigate and treatment is condition as you deem appropriate. Okay, as soon as possible, whatever. Okay, any mistake?
Yes.
Yes, sir.
What is the mistake?
You wrote treatment instead of treat.
Why
Is a way is in verb. To treat is a verb.
Sir, treatment is a noun.
yeah
Treatment is noun and treat
yeah
will be verb.
Well, that is good. Can anybody tell me what is the term that we use for this grammar rule?
Manage. For the
No,
investigate and manage is condition.
no, that is okay, but there is a grammatical rule for these things, and there is some specific name, okay, of this. Mostly when we are in hurry, we make these mistakes. Okay, so this is called parallelism.
Parallelism.
Even I don't remember the exact spelling. Parallelism. Okay, parallel means something that is parallel. Okay. So smooth, same. Okay. So when we have a list of words, so we mostly use the same type of word. Okay. This is verb. It should be verb here also. Okay. For example, if I change this, no, your further investigation and treat would be highly appreciated. Now this is verb, treat is verb, and investigation is
No.
noun. So this is grammatically wrong. Okay.
Okay.
Here I have used nouns. Now I am using verbs. Okay. I mostly don't tell these, tricks. I only give these tricks in my VIP hybrid course. Okay. So now in light of the, I would be grateful if you could further investigate and treat. Okay. So treatment is wrong and treat his condition as you deem appropriate. Okay. So you can tell these things. Okay. So this is my channel and here you can see the videos. This is a nurse and today good morning, good evening, doctors, nurses, and pharmacists. Today we have another success story. Yeah, she has just given me the this interview today, but it's still not on my YouTube channel. It will be soon there. Okay. Well, you can see here first attempt 313 speaking.
218 writing.
218 in writing is a nurse. Okay, is a nurse. Miss ID. 218 writing. This was premature attempt without any feedback. Then she joined with me. We have a course for writing and speaking. I gave 8 role plays in 35 pounds. So with 8 role plays, she got 350 in speaking, and her writing improved with VIP hybrid course from 280 to 350. But unfortunately, she got problem with listening in this attempt. And then she got did third attempt and she got B in all modules. Okay, 316 speaking, 316 writing, 316 listening, and 318 reading. Okay, she is in the UK. Okay, so please don't waste your money on any premature attempt. Okay, on any premature attempt. So just one more thing and then we will continue. Is there anybody with us today who has taken VIP hybrid course? Anybody?
Yes, doctor.
Okay. And how much did you get in the real exam? In the writing?
300.
300. Okay. So this student was stuck in writing, but after VIP hybrid course, she was just getting 290, 280 these. I think the 290 most of the things. So this is the best course, but I am not taking I will be not taking this course till 5th or 6th of November. And I have just created one course, one slot, okay, for almost 10 doctors only. I was just a little bit short of money and I need a little bit. I am too busy, but I have to do that. So please, if almost 4 doctors have confirmed that they will join, I will take almost 10 doctors in total. I'm just taking doctors because a little bit easy with doctors to finish in 14 days and they improve very quickly. Otherwise, I have a lot of nurses who are waiting for my course. Okay. So please, I will wait for 1 or 2 hours after this class. If I cannot complete 10 doctors, so then I will give chance to nurses to take this course. Okay. almost I will take 10 students, 4 or 5 doctors, 4 or 5 nurses. Okay, not more than that because I am too busy. I have, still 6th of November, I will not be taking any other writing course. Okay, so many of you will be asking again, please. Okay, so I will be not taking any course. If there is any chance, I will. Okay, you people cannot see this. If there is any chance, okay, I will update you in the WhatsApp groups, but it would be less likely. So please, if any of the doctors wants to join, please text me after the class within 2 hours after class. Okay, if you cannot join, if you do not want to join, then I will take the nurse. Okay, I have a lot of nurses waiting for this course. Okay, yeah, I will consider, let us wait for doctors. Okay, so 2 hours after this class, and then I will take nurse. I need to take 10 students at least, almost 10, not more than that, because then honestly it takes me a lot of time to give feedback, because I give individual feedback. Not more than that, because at this moment I need time to study for my further studies. So I just did it because I needed a little bit of money for my exams and these things. Otherwise I was not planning. Okay, now let us continue. So doctors, please, if any of you wants to join, please text me within 2 hours after we finish the class. Okay, so that I can take the nurses if you people are not interested. Okay, so thank you so much. So now thank you for listening this advertisement. Okay, I'm sorry for that. Okay, so now we should go to the today's visit. Okay, today's visit. Okay, okay, so in today's visit, what is important? In today's visit, what is important? Can anybody tell me?
No improvement.
Somebody asked about the course fee. Okay, the course is in 100 pounds, but I gave mostly 30% discount. So after discount would be only 70 pounds. And believe me, this is nothing. The way I teach, this is nothing. Okay, because I give individual feedback. I work on your individual mistakes, and all the things are done by myself. Okay, so how you will, the main thing here is just no improvement. You were right, there were no improvement in his previous symptoms. Then you will write this. So will you use postprandial, or you will use 30 minutes after drinking milk?
Postprandial.
Postprandial. Why?
Because
Why?
we are writing the letter to the medical person.
Yes, you are writing to a pediatrician. Okay.
Yes.
So you will use medical terms. Okay. Will you use that mom describes the vomit as flying out of his mouth, or you will write projectile vomiting?
Projectile vomiting.
Projectile vomiting. Okay, this is, you can see how the examiner is using the things. As this is written by myself, I am telling you the trick. Okay, that we use. Okay, so if one student starts like after drinking milk and mother describes it flying out of his mouth, it is not wrong. Okay, but is not good. Okay, non-bilious is already a good term. Okay, every time after drinking milk, it is very important also, every time after he drinks milk. Not making wet nap is very important because it shows dehydration, and these things are negative. If you wish, you can skip them, or if you wish, you can write them. I mostly skip these things. Okay, then is the examination. It is not active, is very important. Pulse is normal. Okay, respiratory is normal for this age. Weight. You remember last letter with me? Depressive psychosis. Any of you remembers?
Yes,
depressive
Yes,
psychosis
sir.
letter.
Yes,
How
sir.
many of you have written the comparison of weight in that letter? None of you. You were just writing what is the weight, okay? But here is the important, the comparison. How you will compare? You can do two things. You can compare since his last visit or from his birth. I will prefer since his last visit, okay? On the last visit, it was 3 kg.
Yeah.
And this is visit after 4 weeks, okay? You can write he has lost how much? What you will write?
600 grams.
600?
Lost
600?
800
800
grams.
800 grams.
800, okay, 800 grams. Why I am writing here kg and there grams? Why?
Confuse.
Just to confuse a little bit, not too much, because most of you are very intelligent. Here is 3000 grams and here is 2200 grams. So weight loss is 800 gram in just 4 weeks. You can write 4 weeks. You can write since his last visit. This is very important. Okay. Loss of subcutaneous tissue is important. Okay. Capillary referral is increased is important due to dehydration. Dry mucous membranes are important. Okay. In this visit, you will write how the patient presented. Then you will mention the positive thing in the examination. Then you will mention that cow milk allergy was suspected, and then this and this, and the patient was advised to do this and that. Okay, the mother was advised to do this and that. Okay. So can you see one thing? Okay. Can you see one thing? How many things we have written about vomiting in both of visits? A lot of things about vomiting. Okay. This is projectile. This is non-balance. This is there is no blood. It is postprandial. It is 3 to 4 times a day. Okay. It is accompanied by this and that. Okay. But when you will write, what you will do? What you will do? You will organize. Okay. Within a sentence. Okay. Projectile, non-balance. Okay. Not too much things, Dr. Nadeem. Just okay. Important one and very organized way. Okay. Can any nurse tell me what you will write from the examination in this patient? What you will write? Any nurse? Any nurse?
You were right. The mucous membranes are mildly dry, and abdomen soft and tender, and
Soft
then
and
the loss of
tender.
weight.
Okay. And
Then the loss of weight, sir.
loss of weight. Saturation is okay. Pulse
Yes,
is
sir.
okay. Respiratory rate is okay. Mucous membranes are mildly dry and abdomen is soft and tender. Okay.
So maybe I am.
Okay. You know, I should not tell all the tricks because then you people will know all the tricks. Okay. Okay. One trick to distract or to confuse the students. Can you see which tense I am using in this visit? All of you can see. All of you can see which tense I am using.
Yeah, mother bring
Yes.
present tense.
Present simple.
Present tense.
Okay. You know what the genius people will do is, genius people will write, okay, they will just take the name of the baby, okay, Braxton, okay. Braxton was brought with, Braxton, okay, mother brings Braxton to GP clinic with vomiting as he starts, okay, it starts 5 days ago, and it occurs at 30 to 40 minutes. It is non-ballast, it has no blood, this and that, okay? Why I'm using present tense here?
To discharge us.
As a distractor or
Yeah, this is case notes. In case notes is just like, you know, short forms. And in case notes, when I am writing that visit, I can use at that time, okay? Just imagine I'm writing at that time, it brings and this is done, okay? But sometimes the examiner uses present tense in the past visits, okay? And when the students will write the letter, then it is past visit. Then it's not that visit, okay? Just imagine I am writing this visit on this date, on the same date, okay? On 9th of August, on the same date, okay? So I will use present tense because I am writing at that time. Okay, then patient comes, I write this visit also. I add this visit, okay? And then I send this patient to the pediatric specialist, okay? But when you will write letter, you will be on this date. You will be on this date, okay? So what tense you will use?
Past tense.
Past tense for
or
9
initial
Past
2023.
tense,
past
okay?
tense, and for the today visit
You
we will
know
present.
what is the common, I should say in a wrong way, what is the commonest way? Commonest, okay? Just wrong way, okay? The most common, okay? Or you can only say common. What is the commonest mistake of nurses in the past visits? Can anybody tell me?
Yes.
If you have taken my course, okay, when I mark your letters, so what is the common mistake the nurses make in the past visits? Can anybody tell me?
Yeah.
Yes, sir.
We'll write the present tense in the past visit.
They use present tense in the past visit. Okay, this is the common mistake of many nurses. I keep saying this, don't use present tense in the past visit, but still on the next day, again the same mistake, okay? And then some of them, after they write letter, then they see where is present tense and they change, okay? After writing. So please be careful about these things, okay? So can anybody tell me which visit you found difficult to write? Today's visit, first visit, or this birth history? Which part was difficult so that I can quickly discuss or write? Today it would be difficult to mark letters. Maybe we arrange it for tomorrow. I have to operate.
Birth history.
Birth history is very easy. I will write. Braxton was born. Braxton was born by spontaneous vaginal delivery in small, okay, not in capital, by spontaneous vaginal delivery at 38 weeks. You can add only 38 weeks at 38 weeks of gestation, okay? Then you can write in the same sentence, and his birth weight was 3.3 kg, or you can write a separate sentence, his birth weight was 3.3 kg. Apgar score and use of force of episode is already not used. Apgar score is not too important, okay? Place of birth is also not important, okay? This at least write these three things: vaginal delivery, gestational age, and birth weight, okay? Can anybody repeat with me what you will write? Any nurse? How you will write?
Spontaneous vaginal
No,
delivery.
spontaneous vaginal delivery, no. Just make the sentence.
Braxton was born by spontaneous vaginal delivery at the age of 38 weeks, and his weight was 3.3 kg.
his birth weight, okay, birth weight, and the age would not look better, okay. Add 38 weeks of gestation, like this you can mention, okay.
Okay, sir.
Then nothing is important about mother and father, okay. Then okay, so okay, so let me tell you how you will write the initial visit, okay. So I will start with initially on this date, okay, 09/08/2020. Braxton was brought by his mother. So we start 5 years ago. I will write with a 5-day history of, okay, with a 5-day. You can see this the way, in the same way as we use in the purpose, okay. This mistake the student have made, okay. A 7-week baby. I will explain someday, okay, in the detail, okay. With us 5 days, we need hyphen here and day without s, okay. With a 5-day history of
Vomiting.
okay, with vomiting we can use any other thing, okay.
Non-bilious vomiting.
Non-bilious, okay. Vomiting after 30 to 40 minutes. After 30 minutes of drinking the milk, okay. Only you can write milk, okay. 3 to 4 times a day I will skip, okay. We don't need to write each and everything because I cannot adjust in the same sentence. If you can adjust anywhere 3 to 4 times a day, you can adjust, okay. I will skip it because I cannot write a new sentence for 3 to 4 times a day, okay. Okay, then I will skip this no fever, cough, runny nose, and diarrhea. There is no, okay, this negative, I will not write, okay. This is important. If we can make less wet nappy than feeling hungry even after drinking milk. This is important, okay. At that time, he was making less wet nappies, okay. And he has already written, so I will only use the verb, okay. And was feeling hungry even after drinking milk, okay. Done. So now we have written 2 sentences about symptoms. Now we have what we write the examination, okay. You can write on examination at the start. On examination, what we write in the examination, can anybody tell me?
His mucous membranes were
Mucous
mildly
membranes.
dry, and abdomen was soft and tender.
Okay, okay. So what happened here?
His weight was reduced from. Oh, sorry.
No, just okay. Just let me. Okay, on examination. Sorry, no, I need to open here. Okay. On examination,
Is mucous membranes
as I
was
want to mention, okay, just let me tell you. So as I want to mention weight and mucous membranes, you can write mildly dry and abdomen soft and tender and weight separately, or you can write in the same sentence. Okay, let us try. Okay. His mucous membranes were dry and his abdomen was, it should be one thing tender, right? Soft tender thing is not, both the things cannot be together. Okay, but anyway, we need to write what is written there. Okay, was soft and tender. Okay, then I want to mention in the same sentence, I will not write on examination. His mucous membranes were dry and his abdomen was soft and tender. Maybe, or you can write on examination also, both are okay. He had lost, or he lost, both are okay. He lost about 300 grams since his birth, as your birth weight would be mentioned there. So the one thing you can add in the same sentence, okay, but it would become a little bit difficult for you to manage. I will write there, but for you, you can write a separate sentence because.
So it would be nicer if we use a fan buzz conjunction. It will make a good impression in the.
Yeah, but we
uh,
should not overuse, okay, and we should not make long sentences. I have already used here, okay. I already used here. That is why I was avoiding. But I will use here in the same sentence this part. But if for most of you, it would be better to write a new sentence here, okay. But anyway, it
Yes,
will
sir.
not make any good, okay. Then we have two things: the assessment and what advice we have given, okay. So I will write one sentence, not two sentences, okay. Cow milk allergy. He was suspected to have is also okay. Cow milk allergy was suspected. Keep diary of symptoms is not too important thing. I can only mention switch to milk formula, okay. And his mother, even it is not written mother, but you will advise to the mother, okay. And his mother was advised to switch or change, okay, to change his milk to elemental milk formula, okay. Okay, enough. We don't need to keep diary of symptoms. This is not obligatory thing, okay. So that's enough, okay. Let us see the words. It looks long, but as the size is big, that is why it looks. It's good. Okay, 80 words, good paragraph. You will write almost, 80 words in the today's visit, less than 80, 70, 60, 70 words in today's visit. And then almost 30 words in the birth history and conclusion and that, okay. So any questions so far? It's okay.
Sir, can we use comma
Comma
after
where?
the suspected? Yeah, cow milk
No.
allergy was suspected, comma and.
Yeah. Yeah, it is okay.
Yes.
This is optional, okay? This is not obligatory. It's optional, okay? There are some rules for that, okay? If you know the rules, then you can use, okay? If you don't
Yes,
don't know the rules,
because
then
two
avoid, okay?
separate sentences can be joined.
Yes, yes. Can we join? And if there is same verb for same subject for both of the sentence, both of the parts, then we cannot use, okay?
And their verbs were different. Yeah.
Yeah, yeah.
Same subject and verb, different verb.
Yes, yes. Okay, so I will mark your letters tomorrow. Maybe I will write today's visit tomorrow, and I will mark your letters because now I have to go for the surgery. Okay, so please, doctors, this is just reminder, please. Okay, I will not be taking writing classes for the next 2 months. Okay, so please, if any of you wants to join, please text me within. You can decide. You can text me within 2 hours. Okay, so your individual, you will get individual feedback on your letters. Plus, I will explain how to write, what is important, what is relevant, what is irrelevant, how to organize all of things about the letter. Then you will be marked for different types of letter: urgent letters, referral letters, discharge letters, letters to non-medical professionals, letter to in case pediatric patient. Two patients in one letter, GP to GP transfer. Okay, so all types of letter. Okay, so please.
So this one curious. I have one curious. I want to know that if I know the conjunctions and prepositions properly, if I will use those in my letter, would it lead to greater marks?
Yes, but if you use naturally, okay, if you use naturally, not overuse, okay, you will see many doctors and nurses just start writing one conjunction, one linking words at the start of every sentence. It is not natural, okay. In addition, then in the next sentence they will write also. In the next sentence they will write consequently. In the next sentence they will write, additionally. In the next sentence they will write any other. This is not natural. Okay, if you use naturally, then it is good. Okay,
okay,
we don't need to overuse these things in OET, because in OET they want us how we will write in the real situation. Okay, be as natural as possible. So
doctor, what about nurses?
Nurses, I am preferring doctors. Okay, because for doctors a little bit easy for me to train them. They get they improve very quickly, and I am a little bit short of time these days. So that is why I'm preferring if doctors. So let us wait 2 hours. There are already 4 doctors who want to join. Okay, so if 1 or 2 more doctors join, or I will complete 10 students. If 10 doctors are not able to complete, then I will take 5 or 6 nurses. Okay, I will text in your WhatsApp group. Okay, after 2 hours whether I was able to complete 10 doctors or not. Okay, then you can join. Okay, thank you so much.
Thank you, doctor.
Thank you, sir. Thank you, doctor.
Thank you so much.